Okay, so
Yeah.
they're both going. So now you're being filmed.
Great. This is awesome.
Y'all have any questions before we start?
A little late for that.
You sure?
I feel like I have boogers or something.
No, you don't. All right, let's go. What is an MLT? Take your turn answering that, or just interact with each other on it.
MLT, it's a medical lab technician. You play with blood. You get to draw blood. You get to plate specimens. Some are stinky, some are,
Not
gross.
so good.
But
Slimy
some are okay. Machines. You're on a lot of machines. A lot of machines.
Also, we are the ones who, we do all the testing on the blood, the specimens, feces, stools, whatever it is, you name it, we're testing it. Our test results determine what the doctor's going to treat this patient with, which is very important. We stand a very important part of healthcare and patients' care, and sometimes their lives are on the line with us. If we result out the wrong results, something false, then we could cause death from that, and that's something we never want to do. This is something that's very serious, but it's a great profession.
Okay. So y'all keep looking there.
He's so awkward.
I am.
Yeah, keep looking there.
About it. Okay. All right. And remember, it's a dual video, so y'all are both on camera at the same time. When one's answering, we're still seeing both. Yeah, I'm not that good about zooming into one person while they answer.
I'll be looking all over the place.
Okay. So we'll do it like the Duggars. We'll keep them together. We don't, keep just two
Duggars?
people.
I thought it was Duggars.
Whatever. All right. Why is an MLT career right for you?
I feel like it's right for me because it's in the health, it's in the medical field. It's something that I've always been interested in. I also feel like it's right for me because I'm the type of person that doesn't like all the blood cut, wounds, gory mess, but I can deal with blood any day of the week as long as I don't see it coming out of a body. And again, it's in the medical field. It's something that has kept me very interested, and I feel like it was a good choice for me as far as to make a lifelong career out of it to support my family.
I'm a very hands-on person. I like being up, doing stuff, running here and there, and when you're in the lab, you're up and around, and you're constantly, your mind's working all the time, and you're just always doing stuff. Your hands are always moving, your feet are always moving, everything is just so interesting, even if you've done it 1,000 times.
And there's always something to do, whether it's working in chemistry, micro, blood bank, hematology, whatever it is. Some department's always going to have something to do at some point in time to keep you busy. You're never really sitting down on your butt. You're constantly moving.
All right. What was your favorite class in the MLT program?
My favorite class was microbiology, thanks to Miss Pittman. She kept it very interesting. There was, always new things to learn. You had to stay on your toes to keep yourself up to
I felt like
par for the test.
I felt like it was problem solving all the time. You were
Right.
constantly trying to figure out, well, what makes this do this, or what makes this reaction, or what makes that color, and it's
Or
just all really
Different
neat.
chemical reactions. You got to figure out if it reacts this way. What organism could be grow. What is this organism that's growing on this plate due to this catalase reaction and whatnot. It's always something to make your mind work.
Right. So when you went to clinical, what was your favorite clinical experience?
My favorite clinical experience was chemistry, and that is probably because it was the busiest department. There was always something to do. There's chemistry testing to be done all day long, and the dimension was running hot during clinicals. I liked it. I thought I hated everything about chemistry during class time because it was just terrible. It was boring. But when you get to the hospital and you get in the clinical setting, it really is an awesome department.
Mine would have to be blood bank. I liked blood bank because it it was also like problem solving for the most part, but it was very critical. Everything was so, it had to be right. Nothing could be wrong, or something really bad could happen.
All right. What are your future plans?
My future plans are to continue my education. I want to start with getting my bachelor's degree after I pass my state boards. And after my bachelor's, I do want to go ahead and get a master's, and I'm wanting to master in microbiology. What the future holds, I'm not sure, but that is my intentions.
I want to, like she said, I want to go and get my bachelor's, and then further on to my master's, and then hopefully become a lab manager one day. That's just cool to me. So, I want to be a lab manager.
How did you pick the MLT program? Or why did you pick the MLT program? Of all the programs we have on campus, why MLT?
Luckily, I had a big cousin who was
That's me.
in the program before I ever entered the program, and she sat down with me and talked to me about what it does and how it works and how it's different from other things in the medical field, and it just really interested me, and I just jumped on it, got in there.
And I think that I had a girl that I was working with at a pillow clinic that talked to me about MLT and told me a few things about it, and also it got me interested because, you know, you don't have to do all the dirty work that a nurse does, yet you're still doing dirty work. You have to play with poop, but at least you don't have to wipe it off somebody's behind.
Right. Correct.
Very true.
What was the biggest challenge you had while you were a student in the MLT program?
My biggest challenge as a student in the MLT program would be getting pregnant with twin boys and having to sit a year out. Picking up with third semester after sitting a whole year out after my second semester was really challenging. You know, you have to go back and you have to completely refresh your memory with everything. It's almost like starting over new with 2 years less of, you know, knowledge, because you have to really refresh your memory on all that. Because of course, I wasn't focused on that year that I was sitting out, trying to refresh myself for starting back. And just being pregnant alone during the program was really challenging because, you know, you don't feel good, you're tired, you're sick. You have to really push yourself to make it and get through it.
Testing. Testing freaks me out. I don't know why. I've always been like that since high school. But the teachers make sure they go over all the information with you, and they always push you to study, study, study all the time for every test. All the tests are just as important as the other ones, but testing would have to be my biggest.
So how did you overcome this big challenge?
I overcome my challenge by thinking about my children and knowing that I had to push through it and I had to do this and I had to finish my degree and continue my education for my kids so that I can support my family.
I just studied a lot all the time, and I thought about how I wanted to be somebody. Not many people in our family has graduated college, and we got to be,
We're high school.
yeah, we got to be one of 3 of us that have gotten to graduate college and push forward, and that was a big step. That was a big accomplishment for our family.
All right, now's your chance to talk about each other. So whoever wants to go first, describe your partner and your fellow graduate or fellow student, fellow cousin. Give us a description.
Well, she pushed me hard. Like, she told me, you're not giving up. You're not, you know, you're going to do this with me. And just, she helped me study. She's a great mentor. She's always been there. She's pretty much a big sister.
This, Avery, she's an amazing woman. Whether she likes to think it or not, she's pretty good. She works hard. She's got a very good head on her shoulders, and she has her priorities in line. She's worked hard to get through this program, and she has, whether she knows it or not, been a huge role model to me.
Good job. And then, what makes you the happiest about choosing to be an MLT?
The fact that I accomplished school, I got a degree, and the happiest that it makes me is the fact that I did it for my kids. I pushed through and I finished school and I got my degree for my children.
Yeah, I did it because it's just, I really don't know what to say. What makes you happy? Everything about it. Graduating and, you know, getting to do it with you.
Oh, you're so precious.
And that I didn't give up. It always makes me happy not giving up.
All right, and here are the surprise questions.
Questions? You said.
Yes, there's 2 questions. We want first, describe your teachers. Give us your assessment of your teacher A and teacher B. Good or bad, funny
They
or
suck.
sad.
No.
Who's fist bumped? I'm so glad you can edit these.
They push too. They push you to be the best you can be. They push you to succeed. They push you to, if you get something wrong, you're going to do it again until you get it right. But that's, I mean, I'm thankful for that, because if they wouldn't have done that, then if you didn't learn it, then you would have gotten like some patients wrong.
I think that they have done a great job with our program and teaching us as a student. I feel like we've all become like a family with our teachers. You know, anytime we need anything, we can call them at any time. We have their cell phone numbers. I mean, I feel like even still with us being out of school, if we had a question to do with something before we take a board, our state boards or something, if we had a question for anything, any reason, all we have to do is call or text them and they'd be right there for us. You know, I feel like Mr. Rector, bless his heart, he has hung in there like a champ with all of us females and one male student. You know, we give him a lot of grief and he puts up with us, and bless his heart for it, because he does a wonderful job with us. He pushes us to do the best that we can do, and he believes in us, and he has confidence that we can be the best MLTs that we can be. And Miss Pittman, she is very serious with us. You know, she'll joke and she'll play with us. She, you know, she's put up with a lot from us too, but she pushes us very, very hard to do what she knows that we can do. You know, she makes sure that we know that we have to have our priorities in line. We have to do what needs to be done.
I agree completely with everything you just said.
Okay. Well, that's all of this part. Thank you so much. You got your fist pump in.
Yeah, I did.